You're on mute, Fiona.
Hello, everybody. My name is Fiona Streeter. I work for the NHS in Sussex, and I would like to welcome you today to our Developing Neuro-inclusion in Healthcare session, where we're really looking at how we work together to keep improving services for neurodivergent people. This is part of a series of sessions, a week-long schedule of events that we've had this week to mark Neurodiversity Celebration Week. And you'll see this is today's Thursday, Neuro-inclusion in Health and Care, and we have one further event this week around which is Unity in Diversity, exploring neurodivergent. And I understand there are still some tickets available for this final event at the Town Art Gallery tomorrow. And there's going to be a link pasted in the chat. It's a fantastic event for working together to develop neuro-inclusion. And you'll see some of the partners that are involved in this event on the screen in front of you now. And I'm delighted to be hosting us today at this session, which forms part of action to support the completion of our East Sussex All-Age Action Plan around our All-Age Autism Action Plan across East Sussex. And again, I think we're posting the link for that in the chat so people can see that if that's helpful to see. So I just wanted to start with some housekeeping for everybody. This is a public event, so in order to protect your privacy, all cameras and microphones have been switched off today. We won't be answering questions during the session today because we've got quite a packed session for you. But what we will be doing is completing a frequently asked questions afterwards, once we've taken some time to look at all of those questions and make sure we can provide kind of some helpful responses. And this will be emailed to people who are here along with the recording. So I just wanted to let people know that. So please do use the Q&A for that feedback as well. And we have an hour today for a number of key items that we want to share with you. So I'll just let you know what those key things are that we're going to be talking about today. As I said, my name's Fiona. I'm hosting us today, and I'll be talking a bit about what we're doing across Sussex, across the NHS, and with other partner organisations that we work with in terms of how we're improving the journey of support for autism and ADHD. Then following me, we'll have Lee, who also works for the NHS, who will be talking to us about how a health or care passport can help your needs be met. And then we have Sean and David from Runway Training, who will be sharing with us how neurodivergent people are training NHS staff. And then finally, Alison and Adam from our Lived Experience Advisory Panel, which is specific to our neurodevelopmental work, will be talking to us about how neurodivergent people are working with the NHS to shape our services and how we work. So I thought it would be really helpful just to say a little bit initially about what we mean by neurodiversity, because I think it's a really important starting point. So we recognise that people think and learn and communicate all in different sorts of ways. And that real kind of jumping to the third bullet point, that brings a real richness. So bring those differences, bring real strengths, but we recognise they also bring challenges. And this is all part of these neurodevelopmental differences are all part of just natural human variation. And then just wanted to say a little bit about why this matters and why being neuro-inclusive really matters. So we know that more people are looking to have an assessment, who are interested in whether they may have an autism or ADHD condition. And that's happening locally across Sussex and is also the same trend nationally as well. We already have a high number of people who are autistic across Sussex, and when we kind of look at us compared to other geographical areas, We are looking to remove barriers and help people be able to access the services that are already available and engage with those more easily, because we know it can be quite a complex picture of services and support that's out there, both from the health service and from other organisations that also support people in this area. We're wanting to strive for better experiences as well, for autistic individuals and their families, and also for people who have other neurodevelopmental conditions such as ADHD. And we're really wanting to support our staff so they can work confidently with local people who may be feeling they may have one of these conditions but haven't been diagnosed yet, or who already have one of these conditions. And this really benefits everybody. So what we found from some of our work, where we may be doing particular work around improving our communication to local people who are neurodivergent, what we recognise is that this also improves our communication generally. So this really does benefit everybody. So we have an approach across Sussex that's shared. We work across health and care in terms of social care and education, which obviously includes schools, and our voluntary and community sector and wider partners. And this is really important because, as we know, services can sometimes feel a little bit fragmented. And it's really important that we come together and to work as effectively as we can across services. Our work includes children, young people and adults, and it focuses on how we can change what we're doing for the long term and really embed that change. So we're not only talking about the assessment and diagnosis pathway, but also how we can support people as their needs might be identified as well, and treatment that people might need subsequent to any diagnosis where that's taken place. So we have it's quite a mouthful, but we have a Sussex all-age neurodevelopmental programme, and we have agreed through lots of work with stakeholders and other organisations and people with lived experience, 3 priorities that we've been working on over recent months and years. The first is that we would support people's needs. And that would be irrespective of them having a diagnosis. So it's really important, as people's needs might be identified, that people can access the support that they need. We are really striving to improve how information about the support that is available is accessed. So by making that really clear and simple in terms of how people can get help. And that includes access to online support as well. And in terms of how we're all working together, we're looking at more joined up assessment processes across NHS services, and training more staff, both in primary care and in our mental health services, and in other services actually that support people, so that more local people can access assessments, because we know this is quite a challenge locally and nationally in terms of people having to wait longer than any of us would want when they are waiting for assessment. So to put a bit more colour on some of these things, in terms of meeting people's needs, irrespective of any diagnosis, we've been doing quite a bit of work with schools. So particularly on our work with schools in terms of how we support them to build their relationships with parents and carers. Improve how the environment can be inclusive within the school settings, and how, for instance, things like school communication can be improved as well. And also sometimes how the environments within schools can be as neuro-inclusive as possible. We've also been doing some research into some tools that help schools identify children's needs as they become apparent. So helping them to identify them, and then working through how support can be put in place. So this is what I'm talking about when I'm saying that we don't want that to have to be reliant on a diagnosis, that it's important that children's needs and anyone's needs is met as that need is identified. And then I just wanted to do a bit of a nod to something that I'm sure many of you will have heard about, which is there is a recent white paper that has been published by the government around the future of special educational needs and a kind of development of alternative provision and an improvement plan. So we just wanted to kind of reference that is something that that is being kind of considered at the moment and will be being worked through over the forthcoming month. And then some other kind of developments that I wanted to reference, some of which we'll be talking about a bit later on in this session. So ensuring that all staff are trained to a good level. So one of the elements of that is our Oliver McGowan lived experience training that we've got some information on in this session today. And another will be, for instance, how we train our clinical staff to make sure that they're really well trained to a good level to undertake assessments. But I'm really looking forward to hearing a bit more from our colleagues from One Way Training about the Oliver McGowan lived experience training. Testing out those tools that can help individuals' needs be met, as I just mentioned in that previous slide. So that's something that we're testing at the moment and evaluating to see what might be useful going forward. And then also encouraging the use of health and care passports as well, so that we can really kind of embed and improve reasonable adjustments for people. And again, that's where we've got Lee joining us from the NHS, who'll be talking a bit more about that in a short while. So I want to say a little bit more about the neurodevelopment programme as well. And I wanted to add in at this point that we've had some key principles as part of this programme. And one is that we are we've really embedded our lived experience partners in this. So listening to lived experience is really, really critical throughout our programme, and that's why it's really brilliant that we've got Alison and Adam talking later about that lived experience advisory panel, because that has been really kind of critical to our programme. As I mentioned, kind of working across organisations and taking a strengths-based approach. So really supporting people to thrive in the setting that they're in and really promoting that understanding and acceptance. So in terms of streamlining our access to support and making it easier for people to get the help that they need, we've been doing some work on improving the clarity and routes into access and support, and ensuring we've got better information both for families and for professionals, because professionals are often really well placed to signpost people, be it families or young people themselves sometimes, or adults as well, in terms of what is available that can be of support to them. And again, that joined up working across services. So there's just some examples here of a new toolkit that we co-produced actually with lived experience people to make ADHD and autism support easier to find. And then we've got some kind of information on there as well around the kind of ways that we are taking that forward. And that's been, it's been really great to have that input from our lived experience people who are really able to help us make this work as best it can for local people. And then in terms of our assessment and diagnosis pathway, we've been working together across a range of services to review and improve our current pathways. So we want to make it easier for people to access support that's available locally. I mentioned earlier training more staff that can assess neurodevelopmental conditions, and by that I mean conditions like autism and ADHD. Designing services with people with lived experience. And just, I'm sure Adam and Alison might talk about some more of the ways they've done this, but what really struck me is just some ways they've been working with a new service that we're mobilising at the moment, that we're implementing at the moment, and really looking at, like, in terms of reminders for people who might have ADHD, what's the best way to send reminders and how often, to help people really be able to access services rather than it being based around how the service works, it really being tailored to what the individual with potentially with that condition might need. And I think that's just been a really helpful kind of practical example of how that can really help. We're building in support that continues after assessment as well. And also looking at how we can increasingly support people who might have more than one condition. And that will also be around, so people often have autism, and ADHD at the same time. And also sometimes people also have mental health conditions alongside as well. So how can we be designing our services to support people that might have more than one condition? And we're trying out new ways of working all the time to see what helps people best. And then, so yeah, this is really a summary of why we really think this is everybody's business. So as I said, we're really working across a range of stakeholders and partners across healthcare, our educational colleagues in schools and beyond, and our voluntary sector and communities. And everyone plays a role in this, as we know. We know that small changes can make a big difference. So something like the reminders of when appointments might be coming up, as I just mentioned, that we've been able to co-produce. They may feel like small changes, but I think they can make a really big difference to how we work together, and also how we support local people. And through this, we're just really striving to create and embed greater neuro-inclusive services that are strength-based, and our communication is strength-based as well. And that we're not just looking at services, but also support that sits alongside that too, that may be provided from a wide range of organisations and agencies, and often the voluntary sector as well play a really big role in that. So that's a quick walk through our neurodevelopmental programme in Sussex that many people on this call will be part of. And I just want to hand over now to my colleague, also from the NHS, Lee Hills, who's going to be talking about health and care passports. Over to you, Lee.
Thank you very much, Fiona. Hopefully you can all hear me okay. And first of all, it's just a pleasure to be able to be part of this meeting today. Thank you for inviting me. So my name is Lee, and for people that don't know me, I'm a registered nurse with learning disabilities. My lack of hair might give me away as being someone who's been around for some time, but I've worked in NHS supporting people with learning disabilities and neurodiversities for many years. And I'm now, for the last 3 years, I've worked at East Sussex Healthcare NHS Trust, or ESHT, where I am the young person's healthcare transition specialist. So what that means is I get to meet young people from the age of 13 onwards. We're following national guidelines around transition from the Department of Health, which dictates that we should be actively getting to know young people who are being supported within clinical specialties from the age of 13, and starting to map their transition pathway towards that eventual transfer of care to the adult world. So I've got the honour of getting to meet young people in hospital settings, and I am one of 3 members of staff within the healthcare transition team. So I've got my colleague Angie, who supports paediatric community-based clinics, and then we've got Susie, who is our team lead, and she'd make sure that we're compliant with national standards, does all the governance. So that's a little bit about me, and I'm here today to talk to you about passport. So if Emma flicks onto the next things, you should see 3 different passports coming up on your screen. So at the end of the day, health passport, if you Google it, you'll find a whole plethora of different types of passports. And I'm always going to say that any passport is better than no passport. But essentially, a passport exists to identify what good support looks like for that individual person. So if we know what is meaningful for the young person, or and I'm talking young person because I support young people, but obviously adults as well, so who have a who are neurodiverse, then we can then start to think about, okay, how can we make reasonable adjustments so that their experience of coming into hospital can be as positive as possible. So these 3 passports here are the ones which have been ratified for use within ESHT, but also within the local offer, which will be my final slide. You'll also see the range of different passports which have been recognised and endorsed for use locally. The one on the left-hand side of your screen there is the autism passport. So I'm going to focus on that one. Let's get rid of the other two. Thanks, Emma. So yeah, if you click on that one again, it should blow it up a little bit more. And it'll come onto your screen. So with all passports, there will be some guidance for the completion thereof. I think one of the key things is that a passport needs to be completed by people who are expert have that familiarity and know that individual well. It can be the young person themselves or the individual themselves, and it can be their families. We'll find that our academic settings locally are very good at helping populate passports. So there's guidance there which says that really you'd be expected to know the young person reasonably well in order to be able to populate their passports. Next bit. So here is the health passport for autistic people. It was created by the National Autistic Society. And as you can see from this front page, it just starts to give you a bit of a pen portrait of important information. If you click again, it should start to populate it for us with a well-known person. Fictional person, I hasten to add. So once we've got a passport in place, this starts to then tell us, okay, what do we need to do that then supports that young person if they're being seen? So I've put some bullet points coming onto the screen now. Practical application. Because I am working in the hospital setting, where we have a health passport in place and we know that a young person or an adult with a neurodiversity is coming in for a planned procedure, we can share this with key members of staff, so anaesthetists, theatre staff, and that can lead to how we then prep for that appointment. So we can have longer times for the appointment. We're thinking about recovery. We're thinking about having side rooms and having families or carers joining as part of that appointment. And we're thinking very carefully about making that as comfortable as we can for each individual. So if you within my role, I will be supporting a range of paediatric clinics within the hospital setting. So for example, this morning I've been Eastbourne District General Hospital supporting paediatric clinics for epilepsy, but I'll also be seen in diabetes clinics, rheumatology, gastroenterology, trisomy 21, a whole range of different types of clinics which are run, and linking in with our paediatricians, our specialist nurses, and embedding transition and passports for people so that we can identify, or our staff can identify, what good support looks like for them. So I mentioned planned admissions. Obviously, there can be unplanned visits as well. So the value of having a passport in place can be that if it sits on the person's hospital notes, there will be an alert underneath their name. And we're going to talk about Oliver McGowan training later, but there's an expectation that all staff will have will recognise that if an individual has a neurodiversity, that we are supporting them in the appropriate way, and if something exists that dictates what that needs to look like, then they can access it readily. So I will make sure that once we've got a passport, that it's readily observable. If a young person or an adult comes into emergency department, for example, we can access that, and as part of triage, we should start to think about how we're then supporting that person for that visit. Reasonable adjustments is exactly that. So we talked about side rooms, but we can this morning, for example, I've met young people with neurodiversities. We've considered the length of the clinic time and the appointment, made it longer. There will be quieter environments, so we've got a quieter room for young people to come and sit in. We will turn out lights, we will put music on, we will do all sorts of things that makes that experience a bit more comfortable. So if we're asking them and they're telling us what their support looks like, we can then start to do that. And also, a passport isn't something that you just see within a clinical setting. I think that, we see these in place within academic settings and schools, and it can be something that a young person or the adult has ownership of and takes to different appointments. So We talk about GP health action planning, for example, and the importance of a GP getting to know individuals who are registered with their practice. So again, passports are something that can be shared with our GP practices too. And I think there might be all of those on that page. Thank you. So yeah, just I thought I'd just share some screens of the typical information that we're capturing. Obviously, there's more pages than this, but in the time that we've got, a bit of a whistle stop tour. These slides will be shared with everybody anyway, so you can access it. But just signposting you to the health and care passports and the local offer website from East Sussex that shows you. There's a table of contents there on the right hand side. Sorry, that shows you the passports which are typically seen. And on the next slide, there is some. It shows you where the website gives you some information about choosing the appropriate health and care passport, what is a passport, how you can complete it, and the value of having that in place. This isn't everything that I do within my role. I think this is just a part of my role. Essentially, what I'm looking to do is understand the needs of each young person that I get to meet. We're implementing something called the Ready Steady Go framework, which again is endorsed and enshrined with it by the Department of Health for use for transition. And it's about empowering the young person, telling us what support you need, but also then being able to signpost to resources, being able to establish what that network of supports looks like for each young person. So whether that's social care, whether there's other NHS organisations, I'm thinking it could be continuing care, continuing healthcare, and other important people who that young person or adult gets to meet, and making sure as part of my role that we're identifying who can be that key person to coordinate and make sure that everybody's talking to each other. So hopefully that's helpful. People that know me will probably tell you that I will talk forever if you give the opportunity, but I'm conscious of the time as well. And hopefully that time that I've been given there is beneficial. But my contact details will come out as part of what's being shared. So if anyone's got any questions at all, I'm more than happy to answer. And thank you very much.
Thank you, Lee. It was really great to hear about how those health passports are helping people access the services they need in a way that can be tailored to their individual needs. So it's really brilliant to hear those practical examples of how you're working that through. So I would like to introduce now Sean and David from Runway Training, who are going to be talking to us about how neurodivergent people are training NHS staff. So over to you, Sean and David.
That's great. Thank you very much. An absolute pleasure. I'm sure I can speak on behalf of Sean and me. Absolute pleasure to be here at Neurodiversity Celebration Week, showing some of the stuff that we do for Runway Training. Runway Training prides itself on being a neuro-inclusive independent training provider. We're based in the Kent region, but we do work across Kent, East Sussex, and South London area. I'm honoured to be joined by Sean today. Sean is our longest serving co-trainer with lived experience of autism in a paid employment training role by Runway Training, as we deliver Oliver McGowan mandatory training on learning disability and autism to people working within the health and social care sector. And the Oliver McGowan mandatory training role is here to share awareness and educate in terms of how we can practically improve life outcomes for people in East Sussex with learning disability and autism. So I'm going to have a little interview with Sean. He's dying to share his experience of working in this role. So over to you then, Sean. I'm going to ask you some questions that I think your delegates would like to find out about today. And so I guess the first question I'd like to ask you is, what does the Oliver McGowan mandatory training role that you've secured as paid employment with Runway. What does it involve as a co-trainer with lived experience of autism?
So I'm going to do a bit of Makaton. So hello, my name is Sean. That was Makaton for any of you guys that don't know if you do it or you don't. That was just an example. So obviously the training that I do and present involves raising awareness for neurodiversity in the workplace and helping people in the care sector understand what it is like to be autistic and the different day-to-day challenges which autistic people face. The training I deliver focuses on a number of key areas. This includes understanding the autistic profile as a spiky profile, which is impacted directly by the environment, getting delegates to understand that the outcome is dependent on the environment itself rather than the autistic person, raising awareness of sensory differences in the environment and talking to delegates about hyper and hyposensitivity, delivering awareness training around the 3 hidden senses, vestibular, interoception and proprioception, educating delegates on how changes in everyday routines can lead to anxiety and other potential mental health concerns, the importance of applying simple but highly effective reasonable adjustments in care settings, and how these will lead to more positive outcomes for patients with autism living in the East Sussex area.
Okay, wow. You do a lot in your training, Sean, don't
Yes.
you? And funnily
I do.
enough, this isn't a new role to you.
No,
We're lucky
no.
enough to have worked alongside Sean for a good year and a half
Yeah.
now. In this paid training role for Oliver McGowan. Can you tell our delegates, Sean, what you really, really enjoy about the role and how you think Runway training has sort of supported and developed your skills as a freelance trainer?
Yes. So the first thing I love about my role is that I can educate people on autism and ADHD and neurodiversity. I also love having the opportunity to share my own day-to-day life challenges that I face, but also the challenges that I have managed to overcome. Obviously, when I first started this, I wasn't as confident as I am now, because obviously public speaking takes a lot of effort and mentally confident. So shout out to all the people that have helped me.
How's that confidence now, would you say?
Yeah, so it's improved massively. And I've just come back from a week in Stoke, or 2 nights.
Yeah.
And they gave me a lovely Easter egg for all the hard work that I've done.
I haven't got an Easter egg.
Well, yeah.
I'll have to have words.
Yeah, I'm sorry. But yeah, and they also thanked me for the knowledge that I have and teaching their care home staff about neurodiversity and autism and ADHD. So it does take a lot of effort to mentally and physically talk in front of people. I wasn't as confident as I am now, so I'm thankful for that. I've come a long way. Obviously.
And why is it then that you love meeting these new people?
So obviously, I love meeting new people because I am very sociable, and this role gives me the opportunity to build my confidence and get to know other people. Runway training has looked after me by giving me reasonable adjustments, such as giving me significant time to prepare myself for training by giving me rotas well in advance, supporting me with developing my ability to travel independently to train in venues. So, for example, getting the train and knowing what train time I have to be on, getting the train tickets and seeing myself off. I never used to be able to do that, but I had training and that helped me.
And I think only 2 weeks ago, you and one of our other co-trainers with lived experience of learning disability, you both travelled independently to where?
Travelled independently to Littlehampton on the train, and we have a group chat. Ollie, our boss, keeps informed, so what train we get and when to get off, and we managed it pretty well. We didn't miss the times, we stuck to the times and we got off when we needed to. Now, if you told me at the start of this job that I'd be able to do that, I didn't think I would. But now, where I am, I've progressed so much.
Fabulous. And of course, you're making those impacts, aren't you?
Yes.
Or, you know, if we think about our end users, if we think about our patients in the East Sussex area, obviously, Sean, you are delivering autism awareness
Yes.
training
Yeah.
as a co-trainer with lived
Yeah.
experience as part of the Oliver McGowan, and obviously your training delegates who are working both in domiciliary
Yes.
residential care.
Yeah. Yeah.
What do you think are the positive impacts that the training you deliver has had? I would say probably firstly on, you know, the harder working staff within
Yeah.
the health and social care sector, but more importantly, the patients that they care for.
So obviously, as an Oliver McGowan co-trainer, part of my role is to respond to delegate questions and to be available after the training has ended. Sometimes they come up to me after presenting and thank me for helping them to see things in a different way, or tell me they know now more about autism and how to interact with their autistic patients because they have been given this information firsthand by someone they know. Obviously, I have done my own research as well, which has been included. I forgot to mention that earlier, but that's another part that I do in my spare time. Obviously, they have also said that following my training, they are more confident in implementing simple, reasonable adjustments for their patients in the care sector.
Mm-hmm.
So each care sector has gone away and thought about these reasonable adjustments and say, actually, this is what I'm going to do, this is what I'm going to put in place. And it may work, it may not, but it's what the trying's about. And as long as we can get that trying out there, that's all that matters. They can see things in practical ways to make the care sector more accessible for its service users, and that autistic patients will have more confidence that their voices can be heard and that their needs will be better understood by those caring for them. They appreciate more how simple things like dimming lights and setting up quieter environments can have a really positive impact. One of the things I talk about to delegates is about how they can consider themselves as part of the environment and how they can adjust their language, tone and behaviour in order to make this less overwhelming for their patients.
Okay, lovely.
Thank you very much for listening.
Thank you, Sean.
Yeah.
And on behalf of both of us, thank you very much for allowing us both to share our positive experiences and the impact that we hope that we have in terms of really spreading that awareness across the East Sussex region. Thank you very much.
Thank you, Sean and David. That was so lovely to hear about the impact that that Sean's role as a co-trainer, the positive impact that's had on you, Sean, and also all the great examples you gave about the feedback you've had from staff and how they feel that can really improve how they care for the people that they're looking after. Around things like language and tone and behaviour and the environment. So that was really brilliant to hear. And I'm feeling slightly envious of your early Easter eggs, Sean, as well. That sounds
Not the
very
only one.
Yeah. People are going to come up to me now and ask for me for an Easter egg, because I guarantee it won't just be David on my agenda after me.
Well, thank you very much. It's really great to hear about.
Thank you for having us.
Thank you. And our final section in our session today is about our neurodevelopmental programme Lived Experience Advisory Panel, which we shortened to LEAP. And I mentioned some of the work they've been doing, but my colleagues, Alison from NHS Sussex and our lived experience colleague, Adam, are going to be telling you more about what the LEAP do, because they really have been reviewing and co-producing, co-designing many things as part of our programme. So I'll hand over to Alison and Adam. Thank you.
Thank you so much, Fiona. Hello, everyone. My name is Adam. I'm a lived experience representative and an expert by experience for neurodivergence, and I'm one of the co-chairs of the very long-named, hang on to your hats, the NDP LEAP, which is the Lived Experience Advisory Panel for the Sussex All-Age Neurodevelopmental Programme. We'll just be saying LEAP or panel. You don't need to memorize the whole name of it. And I'm here today with Alison. I'm pointing to my right, but I realize that your screen is below me. Would you like to introduce yourself real quick, Alison?
Yeah, thanks, Adam. Alison Waters. I work with NHS Sussex Integrated Care Board with the Working with People and Communities team, and we host the NDP Leap within that team.
Thank you. Right, so our panel is made up of a group of neurodivergent people from all across Sussex, from various different backgrounds and genders and age groups, and lived experience contexts. That is such an important part of getting lived experience voices to filter through back to NHS services, to have people with configurations of life that nobody would have even thought of. And here's a living, breathing person who can feedback exactly on what it's like for them to participate in the health services. We meet online once a month, and basically we're a co-production group, which means that we work with NHS projects, sometimes as they're starting, sometimes in the middle, sometimes throughout, to make sure that a variety of neurodivergent voices are represented, so that the end product, the end result of whatever project it is thoroughly vetted by various neurodivergent voices. Our members also coordinate with other lived experience group, so we're actively developing a sort of internal culture which advocates cooperation between similar groups across NHS Sussex. Next slide, please. Thank you. One of the You don't need to read all of this. This is just a quick snapshot of our current working agreement. It's just meant to exemplify that one of the cornerstones of the group is that we're amongst each other. So we know that every neurodivergent person is different ways that we like to work, different adaptation needs. So as time goes on and new people join, we keep iterating on how the group itself is run. And this is the example of that. It's our co-designed working agreement. Just recently, we added what I like to call a fidgeting clause, not just to allow, but to encourage that people use their fidget toys and move around and doodle during the meeting, whatever they need. And that is, not many times looked upon nicely. We're here, we're like fidget away, because whatever we need to focus, to be present at the meeting and to contribute, our brains all have ways of doing that. Next slide, please. So these are some of the highlights of the projects that we've undertaken. One recurring theme has been the use of language. A lot of health professionals now want to make sure that they both understand the vocabulary around neurodivergence, understand the words that we the community are using, and what contexts are we using them in, how that matches or sometimes goes against old medical ways to put things that may be a bit out of date. So we're helping develop this sort of compromise vocabulary, and we keep updating that as well. We've also had input into the NHS 10-year plan. We're sometimes asked to make videos, and some of our group who are happy to appear on screen, or maybe just slide in from the side of the screen for a minute to share their experience. That happens sometimes. We often feedback on digital tools like the Dimensions tool. And finally, as my day job is as an e-learning development specialist, the project that's been going on for quite a while now and very close to my heart has been ongoing training design. The team has been developing training for staff across Sussex, which will answer the question, okay, we've received the Oliver McGowan mandatory training, what next? What are the sort of day-to-day implications? How can we go deeper in this base knowledge that we've got through the Oliver McGowan training? So we're currently building that. Alison will speak a bit more to that in a moment. And next slide, please. And over to you, Alison.
Yeah, hi everyone. Thanks, Adam. So Adam's already mentioned co-production, and sometimes that can feel like quite an abstract term unless you're using, of course, the right tools. So some of the tools that we like to use are personas, so that we can imagine what it might be like to step through certain experiences within the journey map of health and care. We call things a journey map. That can sometimes sound a little bit trite, but what we're trying to do, and as Fiona mentioned earlier, some of those very small experiences that people have, they're not all good, and they're not all, you know, sort of really bad either. But what we'd like to try and do is to recognise when and how people are experiencing things like signage or being in that physical space, so that we can either do less or more and really look at those experiences from an individual's perspective. So if we could go to the next slide, I think that would make this look a little bit less abstract as such. So that journey map earlier really would be some of these, what we call touch points. You know, what does it feel like when you're walking into that space? What does the signage look like? Is the space overwhelming? It may be that some of the work that we're doing is not at all appropriate for people because of exactly that. It could feel really overwhelming. So some of the work that we've been doing is with the musculoskeletal team that are, they have been experimenting, and it's been very successful with community appointment days, which are called CADs. And we've had a colleague called Georgia Loop who's actually been coming to the LEAP and using the LEAP as a focus group and a community of practice, really, to actually look at what it might feel like to be involved in a community appointment day if you're living with neurodivergence. And Georgia was a health equity fellow with the MSK team, which was also run with the Health Innovation Network, Kent, Surrey and Sussex. And if we go to the next slide, you'll see an example of a poster that George has put together, and we can, you know, these slides will be shared, but you can also see that poster. And what's been really good about the work with the MSK team is that they've been feeding back the outcomes to the group. So we've got to remember sometimes when we work with people with lived experience as volunteers, it's really important to recognise that we're not paying people. We're actually expecting them to give their time freely, and to keep that momentum going, I think it's really important. You know, we keep seeing the infinity loop, but the infinity loop is really a way that we all try and live by feeding back the really important information, and people are going to give their time, then we're going to feed back very quickly to people about how that time is being used and the outcomes of that. So like I said, we can share this poster and you'll see some of the good work and what that's actually resulted in for people that may have to go to community appointment days that are neurodivergent. And if we go to the next slide, what you'll see is some of the ongoing projects that we're involved in at the moment. So the NDP LEAP, the Lived Experience Advisory Panel, big acronym that we've got, we've already mentioned that. We've got 3 task and finish groups at the moment. We're working alongside colleagues on the ADHD Primary Care Connect, and we have 2 people on a comms group, 2 people on an operational group, and 2 people on a digital group. So 6 people. That's going to be ending soon. And we've also got current work at the moment that myself and Adam are involved in with some colleagues on the neurodivergence training, bite-sized training for professionals in the health and care system. So there's quite a lot of work that we're doing to inform some of those pathways at the moment. And if we go to the next slide, if you are part of the NDP LEAP, there's a community platform that hosted by Go Vocal, and this is a closed group. So if you sit on the panel, you can have access to this and all of our meeting papers and resources. And if we go to the final slide, what we'd really like is some more members for the LEAP. So if there's anyone in the audience today that would like to join the Lived Experience Advisory Panel, we'd absolutely love to hear from you. Our emails are on screen at the moment. Adam Dobey, who's just spoken a moment ago, and Francis Miles are both co-chairs of the Lived Experience Advisory Panel. And I'm working with the Working People with Communities team, and it's hosted within that team at the moment. So thank you everyone for listening to us both today, and I'm going to hand back to my colleagues for the rest of today's session. Thank you very much.
Thank you very much, Alison and Adam. And that was really great to hear about the work that the LEAP are doing. And I kind of referenced some of it. I know from a personal perspective in my role that like the language guide that was worked on has been really helpful in just helping us think about the language that we use. So for instance, using the word condition rather than disorder when we refer to things like autism. And I think that's just been really helpful to embed that in all of our practices when we communicate. I just wanted to kind of add a bit to what Alison was talking about, the ADHD service that we've been doing some work to improve on and are piloting some changes. And it was great because we had lived experience people as part of our initial design that used some of the personas, actually, that persona idea that Adam was sharing. And then, as Alison said, actually within the implementation group. So it's been a really great example of how that's really been able to shape what the newly designed service will look like. So that's been really exciting and really impactful, I think, as well. So thank you to both of you for coming along and sharing that in more detail today. So that brings us to the end of our session today. I know we have a QR code that's just come up on screen, which I think enables you to easily give some feedback on how you found the session today, which will help us as we kind of move forward and do these sorts of things in the future, because we can build in any learning that you share with us. So we've got that QR code, and we've also got an email address there as well, and a link. So that will give you that opportunity. And as we said at the beginning, thank you those of you who've been submitting some questions today. There's various links in the Q&A that Gemma's kindly been posting, so please do kind of take a look at those if that would be useful. We will respond to any questions that have come in, and we'll include those responses with a copy of the recording that we will share out as well. And I'm just going to double check I've said everything I need to with my colleagues who are brilliantly supporting in the background. I'm seeing some thumbs up. So it just leaves me to say thank you very much to my colleagues, kind of Emma, Gemma and Trudy, who've been really involved in making sure this runs smoothly and setting it all up and inviting the speakers today. And thank you to Lee, to Sean and David, and to Adam and Alison for their contributions today. I hope you all have a great rest of the day. I hope the sun's shining as much as it is where you are as it is where I am. And take care. It's been great to spend some time with you sharing our work. Bye.